come to the pharmacy appraisal. Okay, I've already explained what the process entails. It's a 360-degree appraisal that is geared towards continuous quality improvement. We know that the pharmacy within healthcare is one of the high-risk areas. Okay, one of the high-risk areas because of the kind of things we do there, the medications, okay, that is given. And the error margin is really, really very important for us to eliminate. We currently have a lot of quality control and policies in place. So this is a time for us to truly appraise ourselves within the pharmacy. So pharmacist Anne and pharmacy technician Lucy, you're welcome to the HR department. If you're ready, I'm ready for us to go through this process of self-discovery and performance review. You can start from Anne. We'll take through the first bit.
Okay. The first thing here is the job knowledge. How well do you know yourself?
And drug.
Your job. Your job.
Okay. I'm a pharmacy technician. What I ought to do when the patient is to dispense the prescribed drug, the main prescribed drug from the doctor, without no mistake. And if there is anything that I'm confused on, I'm supposed to go back to the doctor so that doctor will tell me.
As a pharmacy technician, your primary goal is dispensing of medication, ensuring that the medication you dispense is safe for the patient. Now, what are the identifiers? Is it enough for the doctor to just prescribe and post on the system and you just start dispensing? What are the things, the quality checks you do before dispensing?
Before dispensing, I will check the diagnosis, check what doctor prescribed. Then if it rhymes with the diagnosis, then I will dispense. I will check the duration and the milligrams, whether they can go. After checking it, I will bring out my drugs and check the expiry date. Whether the expiry date is whether it's close or it's far, or I will check whether my drugs is expired or not, but it will not.
Who is responsible for the LIFO and FIFO system in the pharmacy? Because part of what you say you will check, the safety or the control measure is to check for expiries.
Yes.
Now, if you have a LIFO and FIFO system, within the pharmacy, whose job is it to check it? And if it's within the pharmacy, how regular do we do it? Because that will help you to do what? Eliminate the delay that comes with. Because now you're sure that every medication you have on your shelf and you're dispensing to the patient is safe.
Yes, anybody that is on
The event where the doctor has done a prescription, because within the healthcare we cannot eliminate the error margin. We are conscious. That is why in quality and patient safety, I taught you people, I know I did a training on healthcare quality and safety with emphasis on some of the causes of human error in healthcare. And one of such I remember mentioning was fatigue. Let us say the doctor has seen the patient and made an error. The pharmacy is supposed to act like a stopgap. In the event where you have seen that there is an error in terms of dosage, or in this area of managed care, HMO, diagnosis does not match with prescription. How many of such have you encountered in recent times, and were you able to nip it? Because I'm currently dealing with an issue where somebody didn't nip a situation. Now, how many of such are you able to nip within this appraisal period? Remember, we're looking at 1 year.
every time, even yesterday.
Medication to patients, then it's just surface. There are protocols, there are processes, which is why you saw that I started expanding all of this. Okay. We begin to look at efficacy of drugs, isn't it?
Yeah.
Environment where medication is stored, is safe, is in line with the prescribed pharmaceutical standard. And part of what are the internal controls we have in terms of retaining efficacy of medication?
Okay. For instance, if in the pharmacy, they're not supposed to off the AC in the pharmacy. When the AC is off, some of the drugs loses its potency, and some of the drugs they don't need to be outside, they need to be inside the freezer or fridge. They need to be inside the fridge so that the potency will be retained. But some,
Most times when I go around for prayer, now the first thing in the morning I said, how are you ready to frustrate our patients? That is the first question I always ask. So some people will just like HR. They say, now the HR, no, I will not frustrate the patient. I will make the patient happy. I say, hey, I wanted you to say it from your mouth. So for the past 1 year, how many report has come up against you or for you?
I'm not seeing them. I'm not.
You've not seen.
Yes.
I've not had any issue with any patient.
Okay. The only issue that we have with patient is maybe you delay their time.
Not we, you. You're an individual. This appraisal is about you.
Okay. Maybe.
One that receives the cumulated pressure. A patient who comes in has gone through the processes and has been delayed in those areas. Now comes to the pharmacy and billing. Pharmacy and billing, they are the receiving end.
Yeah.
When those patients come, they expect that magic should happen. And the patient now comes and is not meeting a smiling pharmacist. Oh, you're very welcome. We are so sorry that I know you took time, but be assured that we are doing everything to ensure that we attend to you. Can you please have your seat with a smile on your face? The next thing they will tell me, fam, that they are so tired, pressure, the pressure here.
Immediately when the patient.
We should be under fire to know that see this error, prescription error, and dispensary error register.
Very important.
Very, very important. Just like you have, there's another register we have there. DDA, good.
Yes, yeah.
Now, how well do you know your job when it comes to management of DDA?
DDA after like you inform your pharmacist.
Your man is just teaching you that now. Yeah. Tell the truth. You don't do it. You don't even know. It's like she's putting the words into you. And again, the last time I said draw out a protocol. I told Faman that draw up a protocol. The last time we came for accuracy check, even before that time, I said draw up a protocol. Everybody, what is working in the pharmacy without knowing DDA? Management of DDA. You cannot be a pharmacist or a pharmacist. Okay, good. That is the element of quantitative. As a pharmacist, as a pharmacy technician, let us assume now I am a pharmacy technician. To respond to that question, I can say, HR, within the past 1 year that we are having this appraisal, averagely, I have, as a technician, seen in a shift, seen and dispensed medication for 50 patients. And out of these 50 patients, the average number of prescription per patient, the minimum is 4. The doctor can prescribe an antibiotics, artesunate, paracetamol, name it. Then the highest has been, I've seen a patient within these 50, one patient had like 10 prescriptions. For example, for the patients who had 4 prescriptions, I was able to dispense her medication in line with the standard under 3 minutes, and there was no error, no complaint. For the patients who had 10 prescriptions made, it took me 5 minutes to dispense in line with the standard and all quality control checks in place, and patient is okay. You give me such feedback, I verify it, you have an excellent score. It also means you're beating yourself, because it's important we know these things, okay? Because it will help you improve. You don't just come to work as a technician and anything that comes. No, it will help you manage pressure. And when you plan properly, it will help you decluster pressure. And that you can also add in your CV. Take it anywhere in the world. You know that I'm a guru. Send me to anywhere. I can assure you that I'm getting the result. So tell us.